Hello, hi, good morning everyone. I hope you all are fine. Welcome back to channel Medical with Sanju. I am come back with solutions of past questions 2027 month set. It is one of the NNC set number 21. हामीले अहिलेसम्म 20 वटा सेट हेरिसकेका छौं। आई होप यहाँहरूलाई म्याक्सिमम क्वेशन्स आइराखेको होला बिकज अफ रिपिटेड क्वेशन धेरै आइराखेको छ। फर्स्ट क्वेशन्समा रिपिटेशन्स धेरै आइराखेको छ र जहिले पनि एक्जाममा यदि क्वेशन आउने एक्जाममा पनि क्वेशन आउँछ भने 75% क्वेशन फर्स्टबाट नै हुन्छ। त्यही भएर जति क्वेशन यहाँहरूले चाहिँ रिभिजन गर्नुहुन्छ, जति क्वेशन चाहिँ प्र्याक्टिस गर्नुहुन्छ, एक्जाम भ्यूले चाहिँ राम्रो हुन्छ। सो स्टार्ट गरौँ। यदि यहाँहरूले चाहिँ कुनै पनि सेट मिस गर्नु भएको छ भने सबै सेटको 20 वटै सेटको लिंक चाहिँ डिस्क्रिप्सन बक्समा शेयर गरेको छ, हेर्न सक्नुहुन्छ। स्टार्ट गरौँ आजको सेट। क्वेशन नम्बर 1, प्लेसेन्टा डेलिभर्ड विदिन ऑप्शन ए 10 मिनट्स, ऑप्शन बी 20, ऑप्शन सी 30 एन्ड ऑप्शन डी 40 मिनट्स। इसको राइट आंसर हुन्छ ऑप्शन सी 30 minutes. If placenta not delivered within 30 minutes, it causes other abnormalities called retained placenta. Sometimes ask the questions retained placenta. What is retained placenta? You have already idea about that. The placenta which is not delivered within 30 minutes, this is called retained placenta. Question number 2. According to Government of Nepal, first postpartum visit should at option A within 24 hours, option B within 3 days, option C within 7 days, and option D within 28 days. The right answer is option A 24 hours. There are 3 visits in postpartum. First one is 24 hours, within 24 hours. This is immediately, and within 7 days, this is yearly, and remote up to 6 weeks. Question number 3. What is the time for taking emergency contraceptive progesterone? Option E 24 hours, option B 48 hours, option C 72 hours, and option D 120 hours. The right answer is option D 120 hours. यो क्वेशनमा कहिलेकाहीँ मिस्टेक हुन सक्छ। पहिलाको डाटा अनुसार विदिन 72 आवर्स मा दिन्थ्यो, 3 डेज मा, तर अहिले चाहिँ चेन्ज भएको छ, 5 डेज मा दिन्छ 120 आवर्स। र हार्मोनल यो भनेको चाहिँ फिमेलले लिने कन्ट्रासेप्टिभ्स हो, फिमेल हार्मोन। दिस इज कल्ड प्रोजेस्टिन हार्मोन and it contains the hormone levonorgestrel. If there is any missed pills or ruptured condoms, at that times use emergency contraceptives within 120 days. Question number 4. Antidote of magnesium sulfate. Option A calcium gluconate, option B nustigmine, option C physostigmine, and option D none of the above. I hope you know the answer of these questions. The right answer is option A calcium gluconate. In the case eclampsia, preeclampsia, or antihypertensives, magnesium sulfate is used, and the antidote of magnesium sulfate is calcium gluconate. Question number 5. Sequence of management of third stage of labor is option A oxytocin, CCT, and uterine massage, option B oxytocin, uterine massage and CCT, option C CCT, uterine massage and oxytocin, option D uterine massage, CCT and oxytocin. This is the active management of third stage of labor. र तीनवटा चाहिँ म्यानेजमेन्ट यसमा खास गरी गर्छ, oxytocin, control contraction, and uterine massage. Option A is right answer. Oxytocin 10 unit दिन्छ IM थाइमा. Question number 6. The main cause of physiological anemia in pregnancy is option A increased plasma volume, option B iron deficiency anemia, Option C, hookworm infection, and option D, acute or chronic blood loss. Due to increased plasma volume. During the pregnancy, hemodynamic change occur in pregnancy to prepare for expected blood loss at delivery. Physiological anemia occur in pregnancy because plasma volume increases more quickly than red blood cells. And the main management of the physiological anemia in the pregnancy is maintenance of diet and oral iron supplementation. Question number 7. All of the following statements are true for metaphysis of bone except option A, it is the most vascular part of bone. Option B, it is the strongest part of bone. Option C, growth activity is maximized here. And option D, it is the region favoring hematogenous speed of infection. Right answer is option B. It is the strongest part of bone. यो चाहिँ मेटाफाइसिसको लागि हुँदैन. Metaphysis is the neck portions of the long bone. The true statement of the metaphysis is right, like it's located at the end of the bone. It's covered by articular cartilage. It contains the growth part. Sometimes you guesses the option D. It is favoring the hematogenesis speed of infection. तर यो चाहिँ हुँदैन. यसमा के हुन्छ त like that कि metaphysis is located between the diaphysis and the epiphysis. A relatively rich blood supply and increase the vascular status makes the metaphysis prone to hematogenesis speed of infections in childhood and osteomyelitis case मा. So यो त ट्रू भयो हैन, बिकज अफ यहाँ ब्लड सप्लाई बढी मात्रामा हुन्छ त्यही भएर चाहिँ चान्सेस हुन्छ. तर यहाँ एक्सेप्टमा सोधेको छ. सो द राइट आन्सर इज अप्सन बी. Question number 8. If the nurse is administering a cleansing enema to a client with a fecal infections, before administering the enema, the nurse places the client in which position? Option A, left seams position. Option B, right seams position. Option C, on the left side of the body with the head of the bed elevated 45 degree. Option D, on the right side of the body with the head of the bed elevated 45 degree. Right answer is option A, left seams position. Question number 9. Physician prescribed a hypotonic solution IV for a client. Which of the following IV solution would the nurse expect to prescribe? Option A, 5% dextrose in water. Option B, 10% dextrose in water. Option C, 0.45% sodium chloride. And option D, 0.95 sodium chloride. The right answer is option C, 0.45% sodium chloride. Isotonic 0.9% sodium chloride. Hypo means कम भयो, so 0.45%, and hyper means higher than the 0.9, that is more than 9. This is hypertonic. Question number 10. When suctioning an unconscious patient with nursing interventions, should the nurse prioritize in maintaining cerebral perfusion? Option A, administer diuretics. Option B, administers analgesics. Option C, provide hygiene. And option D, hyperoxygenate before. Right answer is option D, hyperoxygenate before starting the oxygenated, and also hyperoxygenate after doing the suctions. Question number 11. The process which makes inanimate objects safer to be handled by health persons before cleaning is? Option A, sterilization. Option B, high level disinfection. Option C, decontamination. And option D, cleaning. This one is decontamination. Option C is right answer. Sterilization means killing all the microorganisms. Disinfection, eliminating or reducing the harmful microorganisms. Antisepsis means a form of decontamination, and cleaning with the soap or other waters like normally. This one is a decontamination procedures. Question number 12. A patient is receiving 1000 ml of fluid per 24 hours using an IV sheet with a drop rate of 50 drops per ml. Nurse should plan to regulate IV is option A 10 drops per minute, option B 15 drops per minute, option C 20 drops per minute, and option D 30 drops per minute. इसको कैलकुलेशन 1000 into 15 by 24 into 60 it's equal to 10.41. That is 10 drops per minute. Option A is right answer. Question number 13. Recommended temperatures C and pressures for autoclaving steam under pressure. Option A 120 degrees Celsius or 250 degree Fahrenheit, 160 A pressures and 50 lbs per inch 2 and 430 minutes. Option B 120 degrees Celsius. Option C 100 degrees Celsius and option D 97 degrees Celsius. Right answer is option A 120 degrees Celsius. Question number 14. What is the primary purpose administering potassium chloride infusions to the patient with diabetic ketoacidosis? Option A treatment of hyperapnea, option B prevention of flaccid paralysis, option C replacement of excessive losses, and option D treatment of cardiac arrhythmia. This is treatment of cardiac arrhythmia. Option D is right answer. Question number 50. In disease transmission cycle, human beings are option A infectious agent, option B sources, option C mode of transmission, and option D portal of eject. Human beings are host, infected person. She or he is sources. Option B is right answer. Question number 16. Which laboratory test is useful for pancreatitis? Option A serum glucose, option B serum bilirubin, option C serum amylase, and option D serum potassium. Serum amylase. Option C is right answer. Question number 17. Cyanosis is seen when? Option A concentrations of CO2 is high in blood. Option B concentrations of deoxygenated hemoglobin is higher than the 5%. Option C extremities are cold, and option D all of the above. The appropriate answer is option B. Concentration of deoxygenated hemoglobin is higher than 5%. Question number 18. Carbon monoxide poisoning should be treated with? Option A 10% oxygen, option B 100% oxygen, option C 50% oxygen, and option D methanol. The right answer is 100% oxygen. Question number 19. Wrist drop is due to palsy of which of the following nerve? Option B radial nerve, option B brachial nerve, option C vagus nerve, option D popliteal nerve. The right answer is option A radial nerve. Question number 20. Following are characteristics of a nursing process except option A task oriented, option B systematic, option C continuous, option D dynamic. Nursing process is systematic process, nursing process is continuous process, nursing process is dynamic process, but nursing process is not task oriented. Option A is right answer. Question number 21. Protein content of extracellular fluid is about? Option A 0.5 mg per dl, option B 2 gram per dl, option C 2 mg per dl, and option D 16 gram per dl. The right answer is 2 mg per dl. Question number 22. Which diuretic is a potassium aspirin? Option A, furosemide. Option B, hydrochlorothiazide. Option C, spironolactone. And option D, torsemide. Option C is the right answer, spironolactones. Question number 23. The nurse is caring for client with a nasogastric tube that is attached to the suctions. The nurse monitors the client for the manifestations of which disorders that a client is a risk for. Option A, metabolic acidosis. Option B, metabolic alkalosis. Option C, respiratory acidosis. And option D, respiratory alkalosis. Option B is right answer, metabolic alkalosis. Question number 24. A 40 years old unconscious patient is in a ICU. A duty nurse is going to provide care to the patient. Which would be the best position for the patient? Option A, Sims position. Option B, prone position. Option C, sideline position. And option D, high flower position. The right answer is option C, sideline position. Question number 25. When the elevated temperature rises and falls to the normal every day, this type of a fever is called. Option A, constant fever. Option B, remitted fever. Option C, intermittent fever. And option D, relapsing fever. This one is intermittent fever. Option C is right answer. Intermittent fever भयो, the temperature fluctuates between normal and higher than the normal levels throughout the day. The normal first temperature is 37.2 degrees Celsius or below each day. Remittent fever means temperature fluctuates throughout the day but never fall all the way back to a baseline normal temperature. Daily variation in temperature is more than 1 degree Celsius in 24 hours. Continuous temperature means temperature does not touch the baseline and remains above the normal throughout a day. The variation between maximum and minimum temperature in 24 hours is less than 1 degree Celsius or 1.5 degree Fahrenheit. Relapsing fever means relapsing fever is a bacterial infection transmitted by louse or tick. It is characterized by repeated episode of fever. Question number 26. Many victims of earthquake will live without their food, homes, water, and basic necessities for living. Based on the Maslow hierarchy of need, which monitor were activated for these individuals? Option A, security. Option B, self-actualization. Option C, physiological. Option D, self-esteem. This is physiological need. Option C is right answer. You can see here in the physiological need. In physiological need, breathing, food, water, shelter, clothing, sleep, and safety and security means health, employment, property, family, and social abilities. Love and belonging means friendship, family, intimacy, sense of connection. Self-esteem means confidence, achievement, respect of others, the need to be a unique individual. Self-actualization में mortality, creativity, spontaneity, acceptance, experience, purpose, meaning and inner potentials. यो चाहिँ 5 point को यो चाहिँ hierarchy need मा आउँछ. Question number 27. What is the appropriate size for adult? Option A, 12 to 18 FR. Option B, 19 to 21 FR. Option C, 22 to 30 FR. And option D, 32 to 38 FR. यो क्वेसन चाहिँ कम्प्लिटली छैन. यसको आन्सर अप्सन सी हुन्छ 22 30 यो के को साइज सोधेको छ भने क्लियर चाहिँ यो क्वेशन छैन। Question number 28. A nurse is using blood pressure of a patient using two large BP cup for patient. How the measurement of a BP will affect? Option A. BP will be falsely low. Option B. BP will be falsely high. Option C. BP will be too high. And option D. BP will be normal. The right answer is option A. BP will be falsely low. Question number 29. If the patient is suffering from extreme hypothermia, what will be the body temperatures of patient? Option A. Below 35 degrees Celsius. Option B. Above 35 degrees Celsius. Option C. Exactly 50 degrees Celsius. And option D. None of the above. Below 35 degrees Celsius. Option A is right answer. Question number 30. When attending a client with a head and neck trauma following a vehicular accident, the nurse's initial action is to Option A. Do oral and nasal suction. Option B. Provides oxygen therapy. Option C. Initiate intravenous access. Option D. Immobilize the cervical area. Immobilize the cervical area. Option D is right answer. Question number 31. In what degree the subcutaneous injection is given? Option A 45 degree, option B 15 degree, option C 30 degree, and option D 60 degree. The right answer is option A 45 degree. In this picture, you can clear about administrations of injections, angles. Intramuscular injection 90 degree, subcutaneous 45 degree, intravenous injections 25 degree, and a dermal injection 10 to 50 degree. Question number 32. Length and gauge of needles used for subcutaneous injection is Option A 5 by 8 inch 25 to 27 gauge, 1 to 2 inch 22 gauge, 3 to 4 inch 25 gauge, and 3 to 3 inch 23 gauge. 5 by 8 inch 25 to 25 or 27 gauge. Option A is right answer. Question number 33. What should the pressure on a suction aperture? Option A 120 to 150 mmHg. Option B 100 to 110 mmHg. Option C 80 to 90 mmHg. Option D 70 to 60 mmHg. 120 to 150 mmHg. Option A is right answer. Question number 34. A client is receiving a first-time blood transfusions of packet RBC. How long should the nurse monitor the client to ensure a transfusion reactions will not happen? Option A 50 minutes, option B 30 minutes, option C 45 minutes, and option D 60 minutes. The right answer is option A 50 minutes. Every 15 minutes मा चेक गर्नुपर्छ transfusion reactions को लागि. Question number 35. What is the most common poisoning in Nepal? Option A organophosphorus poisoning, option B lead poisoning, option C kerosene poisoning, and option D mercury poisoning. The most common poisoning in Nepal is organophosphorus poisoning. Option A is right answer. Question number 36. What should be the amount of enema solution for adult? Option A 750 ml to 1000 ml. Option B 300 to 500 ml. Option C 250 to 350 ml. Option C 150 to 250 ml. The right answer is option A 750 to 1000 ml. Question number 37. A patient is scheduled for a urinary catheterization. In which position should nurse place the patient? Option A dorsal recommend position. Option A is right answer. Dorsal recommend positions in female, but in male maintain the supine position. Question number 38. When you are walking on the road, you come Cross of victims lying in the middle of the road that appears to be unconscious, you should. Option A, call for emergency. Option B, call for help. Option C, drag the victims out of the roadway, call for emergency. And option D, give CPR. Right answer is option A, call for emergency first of all. Question number 39. Which of the following is the first priority in preventing injections when providing care for client? Option A, wearing gloves. Option B, hand washing. Option C, wearing gown and goggles. Option D, wearing mask. Hand washing. Option B is right answer. Question number 40. IV heparin therapy is ordered for client. While implementing this order, a nurse ensured that which of the following medications is available on nursing unit? Option A, vitamin K. Option B, aminocaprone acid. Option C, potassium chloride. And option D, protamine. Option D, the antidote of IV therapy is protamine. Option D is right answer. Question number 41. It is defined as any subjective or objective departure from a state of a physical, mental, or social well-being. Option A, mortality, incidence, health, and fertility. Health. Option C is right answer. Question number 42. The cleansing of stomach with solution derived through nasogastric tube is known as what? Option A, gavage. Option B, emesis. Option C, lavage. And option D, stomach pumping. The right answer is option C, lavage. Question number 43. A nurse enters a client room to discover that the client has no pulse respiration. After calling help, the first actions the nurse should take is option A, start a peripheral IV. Option B, initiate high quality chest compression. Option C, establish an airway. Option D, obtains the crash card. After calling help, initiate high quality chest compression. Option B is right answer. Question number 44. Activated charcoal is given through which of the following route? Option A, intravenous. Option B, subcutaneous. Option C, NG tube. And option D, oral. The right answer is option C, NG tube. यदि अप्सनमा एनजी ट्युब नदिएको भए ओरल हुन्थ्यो किनभने यो एक्टिभेटेड चारकोलको रुट यो दुईटै हुन्छ हैन तर अप्सनमा दुईटै छ भने बेस्ट आन्सर एनजी ट्युब. Question number 45. Tachycardia means heart rate more than. Option A, 60 per minute. Option B, 80 per minute. Option C, 100 per minute. And option D, 120 per minute. More than 100 per minute. Option C is right answer. Question number 46. Distended neck vein, burial chest is typical features of. Option A, COPD. Option B, asthma. Option C, emphysema. Option D, myocardial infarction. Distended neck vein, burial chest is the features of COPD. Option A is right answer. Question number 47. Hemorrhoidectomy is scheduled for a patient. Which position is best for procedure? Option A, semi-flower position. Option B, high flower position. Option C, lithotomy position. And option D, Sims position. Lithotomy position is right answer. Question number 48. A patient with radiating chest pain, restlessness, dyspnea came to emergency ward. What is your diagnosis? Option A, MI. Option B, angina pectoris. Option C, hypertension. And option D, congestive heart failure. MI. Option A is right answer. Question number 49. Nurse is caring for a client receiving a treatment of packed RBC, PRBC. The client started to vomit and to be nausea. Client's blood pressure is 95 by 40 mm of Ag from a baseline of 110 by 70 mm of Ag. The client temperature is 100.5 degree Fahrenheit orally from a baseline of 99.5 degree Fahrenheit orally. The nurse understands that the client may be experiencing which following. Option A, circulatory overload. Option B, delayed transfusion reaction. Option C, hypokalemia. And option D, septicemia. These are symptoms of infection. So, septicemia. Option D is right answer. Question number 50. On review of medical records of 4 clients, the nurse determines that which client is at risk of a fluid volume excess. Option A, the client with chronic kidney disease. Option B, the client who required intermittent gastrointestinal suction. Option C, the client with an ilectomy from a recent abdominal surgery. And option D, the client with chronic kidney disease. Option A is right answer. Question number 51. The nurse is caring for a client with a serum potassium level of 3.5 mAq per L. The client is placed on a cardiac monitors and receives 40 mAq PCLs in 1000 ml of 5% dextrose in a water IV. ECG pattern indicates to the nurse that the infusion should be discontinued. Option A, narrow QRS complex. Option B, shortened PR interval. Option C, tall packet T wave. Option D, prominent U waves. Option C is right answer. Question number 52. The nurse is preparing to administer an enteral feedings to a client nasogastric feeding tube. The important actions of the nurse is: Option A, verify correct placement of the tube. Option B, check that the feeding solutions match the dietary order. Option C, aspirate abdominal contents to determine the amount of last feedings remaining in stomach. Option C, ensuring that feeding solution is at a room temperature. First of all, verify correct placement of the tube. Option A is right answer. Question number 53. A nurse is performing routine assessment of a IV site in a patient receiving both IV fluid and medication through the line. Which of the following would indicate the need for discontinuations of the IV line as the next nursing action? Option A, the patient complains of pain on a movement. Option B, the area proximal to insertion site is reddened, warm and painful. Option C, the IV solution is infusing too slowly, particularly when the limbs is elevated. Option D, a hematoma is visible in the area of the IV insertion site. The area proximal to insertion site is reddened, warm and painful. Then immediately discontinue or stop the IV because of this is the sign symptoms of infection. Question number 54. When assessing the patient for fluid and electrolyte balance, the nurse is aware that the organ most important in maintaining this balance are the: Option A, pituitary gland and pancreas. Option B, liver and gallbladder. Option C, brain stem and heart. Option D, lungs and kidney. Lungs and kidney helps to maintain fluid and electrolyte balance. Question number 55. A nurse's role in consent is to: Option A, explains the procedure. Option B, witnesses the voluntary signature. Option C, advise the patient on the best choice to make. Option D, to inform the patient of the surgeon's fault. The right answer is option B, witness the voluntary signature. Question number 56. The primary goal of therapy for a client pulmonary with chronic obstructive disease is to: Option A, correct the bicarbonate defect. Option B, increase oxygenation. Option C, limit hydration. And option D, improve ventilation. Improve ventilation. Option D is right answer. Question number 57. A 38 years old female client has been diagnosed with a hemorrhoid. Which of the following would most likely be primary cause of her hemorrhoid? Option A, 3 vaginal delivery pregnancy. Option B, a varicositis in her leg. Option C, her age. And option D, her job as a school teacher. These all are the causes of hemorrhoid. But the best answer is option A, 3 vaginal delivery pregnancy is a high risk of hemorrhoid. Question number 58. A nurse is working on a nursing home floor when she smells smoke coming from a patient's room. She immediately runs in the inspect the non-smoking room. A small fire in the client's trash case. This client has emphysema and has oxygen tank by his bedside, so with oxygen being delivered presently by nasal cannula. What should be the nurse's first action? Option A, smother the fire in the trash can. Option B, pulls the fire alarm. Option C, grab the fire extinguishers from the hall. And option D, turns the client's oxygen off. Right answer is option D, turns the client oxygen off. Question number 59. When assessing an ECG, the nurses know that the PR interval represents the time it takes for. Option A, impulse to beings arterial contractions. Option B, impulse to transfers the artery to the AV node. Option C, yes, a node to discharge the impulse to beings atrial depolarization. And option D, impulse to travel to the ventricle. Impulse to travel to the ventricle. Option D is right answer. Question number 60. A client is receiving spironolactones to treat hypertension. Which of the following instructions should the nurse provide? Option A, eat food higher in potassium. Option B, takes daily potassium supplements. Option C, discontinue sodium. And option D, avoid salt substitutes. Option D is right answer. Question number 61. A client enters the ER complaining of a severe chest pain. A myocardial infarction is suspected. A 12-lead ECG appears normal, but the doctor admits the client for further testing until cardiac enzymes study are returned. All of the following will be included in the nursing care plan. Which activity has the highest priority? Option A, monitor vital sign. Option B, completing some physical assessment. Option C, maintaining cardiac monitoring. And option D, maintaining at least one IVSS site. Maintaining cardiac monitoring. Option C is right answer. Question number 62. Which of the following blood test is most indicative of cardiac damage? Option A, lactated dehydrogenase. Option B, complete blood count. Option C, troponin first. Option D, creatine kinase. Troponin first. Option C is right answer. Question number 63. A 12 years old male client is admitted to the psychiatric unit with the diagnosis of schizophrenia acute episode. He is having auditory hallucination and seems disorientated to time and place. The nurse knows that hallucinations can be explained as option A, distortions of the real auditory or visual perception. Option B, sensory experience without foundations in reality. Option C, voice that is hardened by the client but is not really there. Option D, idea without a foundation in reality. Hallucination means sensory experience without a foundation in reality. Option B is right answer. Question number 64. Question number 65. The maximum amount of air a person can expel from our lungs after a maximum inhalation is option A, residual volume. Option B, tidal volume. Option C, vital capacity. Option D, inspiratory. The right answer is option C, vital capacity, and this is the normal. Question number 66. The nurse assesses the patient is experiencing abnormal cycles of respiration that are increasingly deeper experiences than shallow with the possible period of apnea. This type of abnormal type of respiration is called option A crackles, option B dyspnea, option C kind stroke respiration, and option D stridor. Kind stroke respiration, option C is right answer. Question number 67. A scrub nurse is doing surgical hand washing. Which activity by a scrub nurse doing surgical hand wash invested by nurse supervisor? Option A keeping the hand higher than the arm at all the times. Option B wash each side of arm to 3 inches above elbow. Option C remove all the jewelry. And option D keeping the hand lower than the arm at all time. In the surgical hand washing, keeping the hand higher than the arm at all times. Option A is right answers. And in medical hand washings, always keeping the hand lower than the arm. Question number 68. Which of the following is the common complications of peritoneal dialysis? Option A peritonitis, option B weight gain, option C hernia, and option D inadequate dialysis. Peritonitis, option A is right answer. Question number 69. The nephrotic syndrome is characterized by all of the following except generalized edema, hematuria, proteinuria, and hypolipidemia. Hematuria, option B is right answer. Question number 70. A nurse observed the foot of diabetic clients and found a 4-foot gangrene. She recorded the diabetic ulcer as a grade 1, grade 3, grade 2, and grade 4. It is grade 4. Option D is right answer. You can see in these pictures. In grade 0, no open lesions. In grade 1, superficial ulcer. In grade 2, deep ulcer. And in grade 3, there is abscess formation. In grade 4, gangrene 4 foot. And in grade 5, there is gangrene entire foot. So this is the natural history in the diabetes patient. Question number 71. Breast self-examinations BSE is a screening method used in an attempt to detect yearly breast cancers. Breast self-examinations can be done in appropriate way by using option A pad of fingers, tip of fingers, palms, and all of the above. Breast self-examinations are doing to detect the any type of the breast cancer in the breast. In this cases, they use the pad of fingers. Option A is right answer. Question number 72. Which of the following is not a sign of depression in an older adult? Option A impaired speech. Option B difficulty sleeping. Option C worry about becomes burdens. And option D hopelessness. Impaired speech. Option A is right answer. Question number 73. The nurse is performing a neurological assessment on a client post-flight CVA. Which findings, if observed by nurse, would warrant immediately attention? Option A decreased level of consciousness. Option B loss of bladder control. Option C altered sensations to stimuli. And option D emotional ability. Immediately attention in decreased level of consciousness. Option is right answer. Question number 74. Which one of the following statement truly represents belly paralysis? Option A hemiparesis and contralateral facial nerve paralysis. Option B combined paralysis of the facials, trigeminal and abducens nerve. Option C idiopathic ipsilateral paralysis of the facial nerve. And option D facial nerve paralysis with a dry eye. Right answer is option C. Idiopathic ipsilateral paralysis of facial nerve. Question number 75. A 65-year-old patient is determined to have a systolic BP reading 125. This patient is option A pre-hypertensive, option B stage 1 hypertension, option C stage 2 hypertension, and option D normal. This is normal. Option D. In this set include 75 questions. Remaining questions I will include it in a set B, set 21B. Thank you so much.